We are Christina,
Oneida,
Alicia,
Colleen.
Welcome to 4NP's podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4 NPS podcast.
If you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
welcome back to 4NP's podcast. We are thrilled to have you join us for part 2 of our interview with Jill Brennan-Cook, assistant professor in the ABSN program at Duke University. In this week's episode, Jill will share some of the mentors that have had an impact in her nursing career. She will also discuss what she values about teaching nursing students, the value of nursing and its impact, and the value of humanity itself. Take a listen.
You mentioned that Duke has that they do a lot of research, and I think that you're involved in some of that research. Can you tell us a little bit about what you're working on?
I'm actually not a researcher, so I don't have a PhD. I like hang out with all the people that I love because they're so interesting and fascinating.
Okay.
Some of the projects I've been involved with and working with are people that do sickle cell research. So that has been very near and dear to my heart. Because they're some of the most vulnerable patients in our healthcare system.
Mm-hmm.
And, they suffer from, well, I think just number one, most of them are underrepresented or Black, and you happen to need a narcotic for your treatment. So right there, it's a stigma. And so they suffer greatly within healthcare systems. So a lot of the people I work with are addressing that stigma and barriers to care. So I've been involved with people that work in that way, and I'm a sickle cell champion, so I get involved in the health system, and we teach some classes to relatively new nurses about sickle cell disease. And just to try to decrease some of that lack of knowledge or deficit, and try to make it better for the patients that suffer unnecessarily.
I actually remember you teaching us about sickle cell. And really, going over and telling us about patients that you had, and it sticks out to me as something that I definitely learned as an undergrad.
I do remember that. Yeah,
me too.
Yeah, because it's like one paragraph in a book, or one blip in a nursing education, but yet they are frequent utilizers of a healthcare system, not by their choice, but because of their disease. So it would. And I saw it all the time. People would judge them. Like, nobody wants to sit in a hospital or in an ER for 12 hours waiting on a pain med. They don't want that. So don't think that they're there for that reason.
Exactly.
So so I always felt like they need more advocates. So that's probably where I could do more work in the future too.
Yeah. It's exciting.
With some of my people.
That's your peeps.
That's right.
Yeah.
So you've been an educator in both the undergraduate realm as well as, I believe you said that you're part of the DNP program, correct?
Yes, I'm involved in the DNP program, but not as a teacher. I work with the scholarship and their projects.
Okay. I don't know if it's a silly question, but I was just going to ask what the differences are with working with undergraduate versus like the advanced degrees, other than, I guess, knowledge.
I think, one of it is I guess you have to relate to everyone when you're an educator, but one of the differences when you are teaching brand new students entering nursing, some of them bring a lot with them, some of them might not, but sometimes they don't know what they're getting into. Whereas if you're teaching a graduate nurse, like I taught in your master's program where you went before I left, they were nurses with a lot of experience, but they might not have been involved in graduate experiences, and that was really hard. They could probably work in the clinical setting, but writing a paper again after 10 years when they haven't written a paper or understanding, like ways of knowing, and theoretical concepts and abstract thoughts,
totally.
or learning a little bit about the whole history of nursing. Yeah.
Painful. Yeah.
Yes.
Yeah. And one of the things that surprised me is I remember in the graduate program teaching nurses about the code of ethics. And I remember having 20 students in the graduate courses, and none of them had heard of that before. And yet that's how we practice, as our code of ethics. So it's interesting how we've missed out on that in education, that we didn't teach that for a long time.
Did we learn that?
So
Oh gosh.
probably this half an inch worth of time.
Oneida, code of ethics. Yep.
I remember.
She's got it on the back of her.
Yeah.
Oh my gosh.
So
She does.
Oneida has the memory, the photographic memory.
Yeah, no. I wish.
She's our regulator. She just
So I
keeps
think
us
some
in
of the
order.
differences are just in how you teach.
Yeah.
Oh, that's
right.
good.
She does.
I think
Yeah.
the differences are how you teach in
Mhm.
this different degrees, but I don't want to ignore the fact that you're always at the same level as a student, because I know we're not when we're getting paid to be an educator, but it's not a top-down approach. It's an equal exchange. And I've learned more from students than I could ever have taught them. So,
Right.
Wow.
and then you teach each other and you
Yes.
share experiences. So, I think just keeping that's some of the differences, in that they might have more to offer. But I have a DNP students, and they'll come in the same way, very, green, as I say, not knowing what to do. And sometimes I'll just simplify it. I'm like, well, tell me what's going on in clinical. Why don't you do your project this way? And I might just give some tools or try to make it easier, break it down, to help them. But I think we do the same thing with basic, brand new students, making something simple,
Right.
like how to draw up an injection when it seems so complicated. It's not, right? It's like doing dishes. So you just have to simplify things, but at
It's so
different levels.
scary though at
Yes.
first.
It should be scary, right? They're real people in those beds.
Yeah. Yeah.
That's right.
I mean, I think in
Yeah.
nursing, the science behind it, we're naturally a little bit of overthinkers, because we're always trying to understand it a little bit more, and some of it is very complicated, the science and understanding how the human body works and what's going on and all the processes that are taking into place, and then what impacts what. But then when we do come across something like, giving an injection, but we're still over here thinking about all these other things, and so we can't bring it down, 30 notches to go, okay, let's just break this down. This is really, this is simple. It's hard to think like that. You need somebody to guide you to change that way of thinking.
Right.
And also, for many years, and I've been just as guilty of doing this, is that you cannot mix clinical practice, like mechanical learning, with theoretical learning in the same set. So you're in a clinical setting and you're asking, say if I was asking a student, like, tell me about this medication and what are we going to do? That's too much if you think about it, because they're just focusing on the mechanics.
Yeah.
And you're asking them all these questions. And I've been just as guilty, and then they found, they've done tons of research that that's not the way we should be doing this. So, and that's the way I learned, and that's the way I started teaching. And it's something that you have to separate those two a lot of times. And I don't think we do that enough.
Right.
No, I think you're right. I think, yeah.
Good point. Yeah.
And it is complicated, but that's like some of my favorite moments in clinical is like putting all the puzzle pieces together and like, oh, that's why they're, just figuring it all out. Or, most of a diagnosis is from a story, and getting the real good history from a patient.
Yeah.
And we forget to do that because we're too busy, clicking on a computer or getting questions answered without really getting that story.
Right. Or just
Right.
reacting to
Task-oriented.
what's going on, even sometimes.
Right.
That's
Right.
true.
Yeah.
Yeah.
One of a physician I worked with many years ago, when the emergency department was hopping, patients are lined up in the hallway, ambulances are coming in, they're backed up. And maybe he would have a patient that had a broken arm. And I would have so much trouble like focusing, but he stopped everything and the only person that he dealt with at that moment was that patient.
Mm-hmm.
And I learned from him to really be in that moment all the time with students too.
Wow.
And we probably could do that in our lives, with our kids, with our families, just be in that moment.
Mm-hmm.
And it's so easy to not be with all the distractors.
Hard.
Very true.
Yeah, with the millions of things that you have to do, it's hard to focus, but it's important.
Yeah, I definitely struggle with that.
Mm-hmm.
It's hard to, I'm always
We
like
all
10
do.
steps down the road. I'm trying to anticipate. I'm like, I'm waiting to catch a football. I don't know.
Yeah. And that goes back to what you were talking about.
But you can laugh at yourself.
Going back to what you were saying about communication and how, like, almost maybe in every class, there should be something about communication and building that skill as you're growing and on your journey, whether undergraduate or in graduate school. But I recently heard something about, body language, like sometimes I find like I could be in a conversation with someone and I find myself like I'm looking here and I'm looking around and I'm like, wait, why am I not just like focusing my eyes, looking straight at this person? And then somebody had even said something about even the way you hold your body. Like you can be in a conversation with someone, but your feet are pointed like in another direction, like ready to kind of walk out the door or ready to get out of a conversation. And it really speaks a lot where, have your feet planted, have your body language, have your face, have your eyes on them and be intentional, like to listen not only to patients, but to your coworkers and just in every aspect. But that communication element is always important, and being in that moment, like you said. Yeah.
I think there's been more of a focus on that since the pandemic too, just really trying to be present because it's been so stressful for everyone.
Crazy.
That's true.
Jill, do you have any questions for us? Any more questions for us?
Yeah, I do actually.
Go for it.
I would love to know, where do you hope to take this nurse practitioner podcast? Where do you see the trajectory of it?
To boldly go beyond.
And what are your plans?
I don't know. I think that's kind of up in the air. We have busy schedules, but we totally enjoy, like, this is, fun for us, and we're getting to learn so many people and learning their journeys, and I think we enjoy it a lot.
Yeah, but I think our hope is that something that we talked about in a couple of earlier episodes is that we found that when we graduated from both RN and from our graduate school as nurse practitioners, I think a general consensus was that we were really trained to work in a hospital as an RN and in a clinical practice as an NP. And really, other than the nurses that we met that had done other things, there was no sense of that, you own your license and that you can really do anything, and that you are trained in a way. It's something you said very early on. I don't know if it was part of the recording or if it was before, but we could do anything. You can transfer these skills that you have, your ability to prioritize, your ability to communicate, your ability to write well, questioning and critical thinking, and all of these skills that we have as nurses. There are so many different things you can do with that. And so one of the things that this has kind of organically grown into is that we discovered we could really teach nurses that, because I'm not feeling that a lot of schools or education, and maybe I'm wrong, but it doesn't seem that a lot of the programs out there really do that. They gear you for one thing and one thing only. So, I know when I graduated as an undergrad, I didn't have my sights on anything other than working in a hospital because that's what I was trained to do. Period. There wasn't even as an RN, there's so many businesses. That's your license and your education. You can have your own business, and there's a lot of different directions you can go. And there's a lot of fields where being an RN is very advantageous to you. And I found that out by accident. I landed a research job, didn't know anything about it, didn't really want to do it, thought I was, really giving up on myself, thought I was like, all right, well, I'm not going to be a clinical nurse. I'm a loser and I'm going to go work in this field. That's what I thought. I mean, that's really, I used to talk to these girls about it all the time. I was like, I'm giving up. It's too stressful. I can't handle it. I'm going to do this because I have to do this for my family right now. And this is what's best. But I wasn't like feeling excited about it or interested. And I didn't know there was a whole career path. And the fact that I've been a nurse in research has been very not only lucrative for me, I made great money doing it. It's been an amazing path that has unfolded, and I could never have known that. I would never have known that. Nobody ever mentioned that. Nobody ever, I just happened to get into it. And that's just my story. There's obviously other stories here too, but I think one of the things is that we were all in a place of thinking, well, what can we do now? We might try this or you might try that. And if you're not happy doing that, then what do you do? Do you always have to just be in primary care, or maybe you want to be in primary care and that's great, but kind of what are the other roles there? And what are some of these people and what are their paths that they've gone on? And like you're doing scholarly stuff, and just hearing people talk about some of our guests, some of the things that they're involved in that they're so passionate about, that are not part of being a clinical nurse. They're part of something else. They have found a passion for themselves, and they've taken that nursing career and they've gone on a trajectory from it. And like you said, it's your own path to walk. Everybody's path is unique. And just showing that to other nurses and nurse practitioners and nursing students, I think we've found that that's an important part of what we hope to give with this podcast. So
I think that's awesome. And that makes sense. And now I totally understand where you're coming from and where you will be going.
Yeah.
So, or you don't know it yet, maybe, but I could see it in your future.
Nice.
I think another thing
what is our future? Can you tell us?
Well, this is continuing, and I think it's more about empowering nurses.
Mm-hmm.
Yeah.
Yes, it is.
And
Yeah.
I have to tell you some pushback. As an educator, it's almost impossible to get students in different clinical sites logistically.
Yeah.
So I'll give you an example. Last semester, I had students go into primary care sites. 70-something students are each doing a rotation in different primary care. And then you got to add COVID. So which nurse is not coming in? Who was exposed? Who wasn't exposed? Who's not going? Who has to move days? It was a lot of work. I would do it again, but it's almost impossible. And when I was in your program, I used to have students go to Planned Parenthood. I used to have students go and follow caseworkers, case management, all different. And as each class size got bigger, my opportunities were less. So it's easier, and more practical to get those basic skills in a healthcare setting. The other problem throughout academia in general is where you go to school and where those opportunities are connected.
Right.
Okay? And what the resources are for each school is very different. So where I work now, there's this huge sim lab. There's a whole sim team. It's just the resources are limitless.
That's wonderful.
But yet it takes a lot of work too. So it's just, you have to be creative. So I have students go into PACE because I think it's important. I tried the primary care experience last semester, but it was a beast of tons of meetings. I don't even know who, with all different stakeholders to get it going. And so it's a lot, but it was definitely worth it. But it is hard to do all those things, and depending on where you're located, like some parts of the country can't even get maternity experiences or peds because there's only one peds unit in each hospital. and they might have to drive or
right. And if there's other
so
schools in the area, you're competing for that spot.
Right.
yes,
Right.
so the simulation
Do
comes
you
in.
provide preceptors to the students there? That's something that comes up a lot in our conversations.
Oh, for the nurse practitioners,
Yeah.
I mean,
For either, I guess.
well, for the undergrad, like for ABSN, I guess it's not undergrad, right? Because they already have a degree, but
Yeah, but they're
they're
still undergrad.
ABS,
Yeah.
they're pre-licensure.
Yeah.
So the pre-licensure, the nurses, I believe, usually volunteer to precept.
Oh, okay.
Have they showed up? Students showed up the first day and said, "I didn't know I was precepting yet."
Oh boy.
Or they get an email saying, "Hey, what's your schedule?" Because they follow the nurse's schedule for 12 week, the 12 weeks.
Right.
So they could be working nights and days and whatever. But most of the nurses agree to precept because it's part of their clinical ladder too, and it's just paying it forward.
Oh, great.
And a lot of the nurses, because there's such turnover right now, a lot of the nurses are 2 years out and they're precepting, and and they know what it's
Right.
like. So
Yeah.
but the nurse practitioner, there's some help, and then there's sometimes trying to find your own.
Yeah, we have and a couple of the people that we've interviewed have said that, and nurse practitioners that we've spoken to, it's getting harder and harder to get preceptors. It's and the schools don't seem to provide them, and I think the general consensus is that's not a great thing. We would like the schools to
No,
provide that for our
and it was
learning,
a
but
challenge. I
yeah,
know for our nurse practitioner students, it was a challenge this time because of COVID too. Everything changed, just that became even more difficult. So they had to delay certain things. Plus telehealth is booming.
Yes.
So they were able to substitute, as you know, for through that. So that was helpful. But North Carolina is a different practice state than New York. So they're still fighting for full licensure and still going and trying to advocate for that through the politically,
Yes.
and a lot of
Yeah.
advocacy for that.
Right.
Mhm. Yeah, but so just knowing, I just had to say that there is to be defensive, not to be too defensive, but to be defensive, that the opportunities for clinicals are challenging for pre-licensure because logistics, it's a lot of work to get students in, and just trying to get approval, and how many can be in one rotation at one time per nurse is difficult.
yeah, it's interesting. It does sound like you mentioned a program earlier that and I forget what you called it something, and I'm losing the word right now, but you said you were teaching a class to the accelerated baccalaureate students that did kind of integrate, though, the things that you can do with your license and other types of nursing, which is something we definitely did not have at the Mount. And I would have liked to have had something like that. I think that's a nice and important piece of the puzzle. So it sounds like Duke has that, though. Is that right? Am I
I think
understanding that?
we expose more. There's more exposure to different opportunities.
Yeah.
So because it's just a bigger center.
Yeah. And with
But
the
you're
help,
right.
yeah.
But I think some of that too comes with, I think we need to boost confidence more and to describe nursing as limitless, because when you talk about the skills and the critical thinking ability, you can use that anywhere in business. When I know people that work for $1 million companies, I could run circles around their practice, and I'm thinking they're not even nurses, but I know I could go in and take over, because of my skills. Do I want that? Not necessarily, but I
No, but
know that the skills are transferable. And I don't know if it's the type of people we draw into nursing. I think they're much more confident now. Each younger generation is more confident. But I think you need to be able to create your own practice.
Yeah.
And because and every journey is very different. And we should never feel guilty for not going into acute care. I couldn't do it now.
Yeah.
I'd be too overwhelmed.
Yeah.
Yeah.
Thank you for saying that.
It's overwhelming, acute care.
Yeah.
Yeah, and you shouldn't feel like you have to do that ever.
Right.
Yeah.
So we just wanted to kind of know if there was any specific person or persons that stuck out to you as a true mentor, and that you were like, I really couldn't have done it without this person. And if you'd like to share.
I have so many nursing mentors that I don't even know where to begin, but I will
awesome.
name a few. One person that you all know is Diane Murphy. She taught. Diane was, well, I guess maybe part of it is because she's a mother of 5 children, so she just, everything is roll with the punches.
Yeah.
But her energy and enthusiasm and positive, like silliness sometimes, but yet very bossy. And I used to tease her. And I forget one time I was teaching nutrition and I was teaching about vitamin D. And I told the class something about, well, it's a very bossy, it's like a hormone. It's very bossy. It controls different, I was describing, and I said, like Dr. Murphy. And I started categorizing the professors with different vitamins.
That's cool.
I said, I could have a whole class on this.
Yeah.
But afterwards, she came up to me and she goes, I heard you told the students, that Dr. D, vitamin D, or something like Dr. Diane. And I said, I was helping them remember, and you are bossy. And she's like, yeah, you're right. But she was very warm and always hugged the students and was very friendly and always treated them like family. And I really admire that about her. And I admire her for so many other reasons too. But her silliness really made me laugh over and over and over. But she's one person that stands out to me that is really amazing. And there's another person I worked with in the past few years that I admire so much in the way she educates. So her name is Lisa Day, and she's pretty famous in nursing. And I had heard about her and read some of her, read her book, read literature that she wrote, but I didn't know her as a person. And I had the honor of teaching with her in the classroom for a few semesters. And I felt like a baby as an educator with all this experience because she was so skilled at Socratic questioning. And she's brilliant. And she left Duke, went to another school. She's all over it, but she was comfortable in her own skin. She never, she wasn't intimidated or afraid to speak up. And I love that about any person.
Yes.
She also felt students' pain, like really felt it in her heart. So if a student said, I'm really sorry, this happened to me, she would just, I'm so sorry. Like she felt it. Yeah, instead of just thinking, I'm thinking, it's okay. Your assignment can be late. Don't worry. She was really like, I feel that. But she's famous in like academia for doing unfolding case studies. So she would teach a class by, creating this case and then asking the students, well, what are your concerns? What are you worried about here? But it wasn't just like, I'm worried about the white count. She'd say, tell me more about that. And then somebody else would say something and she would just be pulling and pulling and pulling. And by the end of the class, I would just sit back. She's so awesome. And I thought I was good at that, but not like her. So she just has a talent and a gift. And I miss her so much because she left DUSON and went elsewhere. And every once in a while I'll text her. But she's amazing. And if you ever have the opportunity to see her speak at any conference, definitely go because you will be mesmerized.
Wow. That would be great. Maybe we can ask her to come on.
Do you feel that you changed the way that you teach because of her?
Oh, yeah. Yeah. I got to be, I would try to practice a lot more with Socratic questioning in the classroom because sometimes you get caught up in all the things you want to say and teach, but that's not really what it's about, right? The students need to learn. I mean, some days you're tired. You just want to like put the students, they'll say, I don't want to do these case studies. Can we just put a PowerPoint up so we can just take notes? And I get those days because we're all there. But Lisa is really gifted at pulling out information and creating that critical thinking clinically in the classroom.
So good.
And not a lot of people can do that.
So good.
Yeah. Mm-hmm. Sounds wonderful. Sounds like a great way to learn something.
It is. And the students just loved her.
Yeah.
Loved her. Mm-hmm. Yeah. Awesome. So that's some mentors. I have so many. Another person at my job now is Dr. Marilyn Orman. And Marilyn has written, I don't know, like probably hundreds and hundreds of publications on scholarship and writing and teaching and clinical education. Just actually her book just came out. But so she's this huge name, right, in nursing. And she's like, oh, Jill, don't worry about it. We're just, she's a person. And I love a person that I could be silly with. And I can say, Marilyn, I need some help. Can we have coffee? And she's there for me.
That's good.
So, and she's everyone's mentor in that whole building. But she's got a lot of experience, clinical, academic, in scholarship and writing. She really brings it down to how to write too. So I'll send her something and I'm like, just tell me the truth. Does it stink? She's like, well, needs more work, or something. And I love that.
Honesty.
I love people that are honest. Yeah. I love people that are honest, that are real, silly. I appreciate that too at the same time. But also that whenever someone that has this great expanse of knowledge that I wish I had, they never make you feel bad that you don't have it. Right? So isn't that what's great about being an educator too?
It is.
Well, all those things describe you to us. So
yeah,
maybe that's why I admire them. Maybe I'm trying to be like that,
Yeah. I don't know. But you have that. That's who you are too.
Yeah. Well, so are all of you.
Thank you so much for sharing your just amazing journey and just your unique, just from relocating and from a nurse to a nurse educator. Is there anything that you know now that you wish you knew then, or is there anything you could say to inspire up-and-coming nurses that are kind of on this journey and maybe struggling, or maybe even want to give up or questioning whether this is for them? What would you say to them?
Well, I think you always have to remember your why when you have those bad days. So I've always loved being a nurse, but I have not loved every single day of nursing, right? So we've all had those bad days. It doesn't mean you give up.
Yeah.
But why you become a nurse is why you stay a nurse. Okay, so I love helping people at their most vulnerable moments. I love making a difference. And even as an educator, I'm outside of the clinical, totally far removed from it, but I still feel like I'm a nurse because I'm making a difference, or at least I try to make a difference in the students that I work with. So I think that all of you probably can speak to your own practice, but being true to who you are is one thing. And I think following that passion that you love. So Alicia, when you were talking a little bit before we started about like your trajectory and where you're not sure, I just say follow your passions and think about what you really like and what makes you happy, and then stick with that and try to find your way and your path. So I know what makes me happy. I love being in a classroom setting. So when we did the Zoom, I was probably the most miserable faculty member. I tried. I really tried, but I wasn't a happy camper. Getting into the classroom is where I am having so much fun and interacting and feeling that energy. And even now, like all the chatter in the beginning of class, I love it. I don't even want, because it means that they're happy and they're learning and they're comfortable with each other and they're friends. So, don't squelch it just yet. Just say, okay, settle down. We got to learn today. They're paying me to be here. So, so I think you have to find your joy. I know I learned very early on that I loved patient interaction and those one-on-one moments. I also liked the fast pace in the beginning. Then when I started teaching, it changes, and your age and whatever reason, I know I can't do it like really acute care any longer because it would overwhelm me. But I do know I love teaching students, and I'm happy, and I feel like it's such a reward. I mean, how hard it's fun, but I also like learning. So every time I have a course to teach or a new subject or new content, I am all over it and having a good time. So I don't know if I answered your question.
No,
But
absolutely. That's wonderful.
I think just find what makes you happy and go for it, and always remember why you are in this profession.
Mm-hmm.
It doesn't mean you put up with, having 10 patients on a med-surg unit or you're in an unsafe practice. You have to definitely know that you own your license. But you do have to find what makes you happy. And I think some of this new pandemic changes that we're seeing all these nurses as travelers, and they're actually, of course, trying to pass laws now to cap salaries.
Oh,
God forbid that nurses are finally making
that's
some
right.
money.
Yeah.
Right.
Yeah, I think it's wonderful. I think it's wonderful that it exposed this huge gap in our healthcare systems.
Yeah. That's an excellent point.
Not really wonderful. I don't mean it from a patient perspective,
No, but yeah.
or even from a nursing perspective.
Of course.
But I think it's about time that it's been highlighted.
Yeah.
Yeah. Awareness is the first step. So
Yeah.
For sure.
hopefully.
So Alicia, I know you're in Colorado, but what is your passion?
I like more of a holistic perspective. I'm not about all just pushing pills and kind of managing symptoms. So I really believe in the word healthcare, and that I want to have a primary focus on what's the root cause of what's going on with what's happening with you. Like, it's from like, if I was to counsel a patient, like, where can we start? Like, at the very beginning. I feel like so many people are, they come in with these symptoms and they have this going on and they just want us to solve it. But it's like,
write a prescription.
Right. And there's, of course, medicines are awesome, and, and it's great, and they have their place. But I feel like there's so many that don't want to get to the root of what's causing their issue, and a lot of it is that manageable through changes, and a lot of people don't want to change. So how to get around that and how to do it in a holistic way. So just kind of like mind, body, soul kind of thing, and just kind of really approaching it that way, whether it's with medication to kind of get it started and get them going, or whether it's dietary changes, mental health, whatever's going on. So many things are mental health related, that manifest themselves in pain or depression, and related to high blood pressure. So I just kind of I just want to see things as a whole. And so I'm still kind of exploring those things as well. And I know there's a lot of holistic and naturopathic medicine practitioners and functional medicine practitioners that I follow to try to kind of get a handle on, how would I incorporate that into my practice? What would that look like for me to do? And then there's a lot of nurse coaches that do a lot of things like that as well. So, that's kind of, in a nutshell.
One of the first things we teach our students first semester is motivational interviewing. So everything they do starts from motivational interviewing. So, because for years, nursing has just, you have high blood pressure, exercise, eat more, eat better, blah, blah, blah. But how come it doesn't work, right?
Yeah.
How come we have a diabetes crisis or an obesity crisis? Because we don't work with patients and meet them where they're at.
Right.
So could you work in a place where you get the experience, but then start to craft your own holistic practice? Mm-hmm. But you have to be careful because that's a slippery slope.
Yeah.
Because I think of people like Dr. Oz, who started off good, but he's a wackadoo, and he doesn't base any of his stuff on science or evidence. And yet people follow him like he, he's natural, He's not natural. He's dangerous. So
Mm-hmm.
I think you have to be careful when you do that, when you go down that slope, because you have to find that balance.
Correct.
But meeting people where they're at and starting some kind of holistic practice is perfect. Why can't you do that? You're in Colorado.
Yeah.
It's where it's happening.
It's true. It's just, me getting focused and kind of getting past maybe my mind and my own thoughts on what I can do and what I can't do. So sometimes we're our biggest enemy, and we work against ourselves sometimes. And I'm speaking for myself, but trying to overcome that.
So it sounds like your mind, body, spirit needs to be self-care first, and you got to figure that part, and then the rest falls, right? Because the only thing, your passions, your interests, the only thing holding you back is you.
And the how. And the how to start,
Just do it.
Yeah, just start.
You don't need a whole path, like 2 years in this, 1 year, 6 months here, you just start one place and then you start crafting it.
It's true.
I'll be your coach.
Okay.
Christina, we can't hear you.
You're muted.
I do that all the time. Is it that like I haven't done it in a while? Is it that you don't know how to start? Are you like just afraid of failure, or like what is it? Fear?
Yes. It's just I don't feel like when I see the responsibilities, like we're looking at some of the nurse practitioners in the clinic where I work. I mean, it's an urgent care setting, and even hearing some of you guys and some of your stories and just the transition and just those, I remember how hard it was transitioning from an undergrad student, not knowing anything, patient care, and now becoming an RN. And it was a struggle, like for me. I mean, some people were able to maybe jump right in it and be like, oh yeah, I'm totally comfortable with this and I'm good. It was a struggle. It was a huge learning curve for me. And I just think of like, wow, this is like that next transition again. And on top of that, just a huge more amount of responsibility and work hours that I see some people doing. I'm like, I don't want to spend 50, 60 hours a week doing this, like doing something I don't love. So yeah, the question is, how do I get into the thing that I love where it doesn't feel like you're working? Because when you're doing what you love, I mean, not that you want to be doing it 50, 60 hours a week either, because you want your free time, and that self-care, like you said, but just my comfort level is just, it's hard. I mean, and that's why even Colleen, I was kind of like, wanted to talk with you because I know we've talked about this before, and just feeling that inadequacy and just being looked at like, you don't want to make a mistake. Like you don't want to hurt anybody. You don't want to be doing something. It's like, wow, I had no idea that I was supposed to do that. And here you're supposed to do this. And it's like, you should know that. And just going through that whole road of emotion and stress, and that first year, especially transitioning as a new nurse, and now to do that again as a nurse practitioner, I just feel like I'm not ready to do that. I'm not ready to take that on yet, so that's where I am. But I know it's coming. It has to, because I can't stay where I am, because I know, I mean, I took my boards, I accomplished a lot. I worked hard to get here. And then I feel like I'm not practicing up to the level of my education, and that's kind of shortchanging myself and, what I could be doing. So
it sounds like it's just your own, you got to just figure out how to get out of your own way. And I don't know how to do that, because you probably know how you did it first time when you had your degree. You passed your boards, you're ready. And you could do baby steps. You don't have to work in a place where you're writing big prescriptions or something like that, and you could always ask someone before you do something.
Yeah. And listen to our podcast.
Oh my gosh.
I know we recently posted something and I'm reading the thing and I'm like, oh, that's good. And then I see Alicia and I'm like, I said that? I'm like, oh, okay. I was like, I should listen to myself more often. I'm like, I guess I've got some pretty good things in here. Because I was like, wow, that's good. And I'm like, wow.
Yeah. I pulled
Maybe
a
you
lot
should
of
make a
quotes from you,
recording.
actually. Yeah.
You should probably make a recording and record yourself and,
That's good.
like little mantras like, Alicia, you've passed the boards. You could do this, and then play it every day, or have Post-it notes or whatever it is, reminders on your phone.
Yeah.
Or there's the four of you. You guys should be, texting each other every day.
Yeah.
Did you apply for that job?
Right.
I used to have a sticker
You
on
can
my
do it.
mirror that said, "You're looking at the problem."
Totally.
But it was good because I read it every day. When I looked in the mirror, I'm like, I'm looking at the problem. I'm right. That's right. I am.
I do that a lot sometimes. I forget. One time I was trying to take a certification test, and I said, "Oh, I don't know. I got to study for it." And my friend said, "Jill, just make the appointment and take the test." I was like, "Hey, right." Sometimes you put off all this stuff,
Yeah.
and you just got to do it sometimes.
Yeah.
I'm really good at that too, Lisa.
Okay.
She'll do it. She's got support.
And Colleen, you're working in research, and Oneida, you're working in GI.
Christina's working in GI.
Oh, okay.
Yeah. I think I'm at the place where you met Linda Ruda.
Westchester Medical Center?
Yeah, I think that's where you guys met, right?
Mm-hmm.
Yeah, that's where I am in GI.
Ah.
Yeah.
Is it fun?
So it's fun. I think starting out as a nurse practitioner, it's hard to find a balance. Like, it's hard to find the respect, I think. I think that we've talked about how, like, when medical doctors, when they're taught, that they're all that and that they can do this and they can do that and you have the power and you're empowered and blah, blah, blah. And I don't think that we're taught that.
No.
Yeah. So I think, and the hours too. It's just, would I have done it again? I don't know. I like what I do, but I don't know that the system is set up for what I want. So it's just a matter of making it what I want, and that'll take time. So
yeah, sometimes you have to bite the bullet until you find your position that you like.
Exactly.
So I worked in the emergency department, and I really, really liked the people I worked with for a long time. But before that, I worked in some ICUs that I liked the work, but I didn't like the people, and I couldn't work like that. So sometimes you'll find, and that's just a minor example, but I think sometimes, especially, you're actually new in your professions again, all over again. And it's just finding that little niche that works for you and getting experience. Yeah, getting experience at the same time. So you might be in whatever practice, right? And then you're like, I hate neurology or I hate cardiology, but you'll do it for experience. And then you kind of get your weasel your way to wherever it is that you want to work. And then you find, your people or your passion and you make it work.
Right. Yeah. So I don't know. I do like where I work, but there are some things that I don't like, and I guess you can't have it all, but I want it all. So
and you can have it all.
Also,
you can do like all the nurse practitioners we're talking to. You can do 10 things and then throw all those cards on the table. And if you have to go, you know what? I really love this and I really don't care for that. And so I'm going to do more of this. You can have 10. That's the great thing about being a nurse is that you can have that, you can have 10 different roles and do more of the roles that you really like and give up ones that you don't mean as much or aren't as important. And it also depends on where you are in life. Like Oneida, you should speak up a little here because Oneida's, but she's got young kids still. Like all of us, the rest of us, our kids are bigger, but Oneida's got 2 young boys at home. So go ahead, you talk. I'm not talking for you.
What am I saying? Oh no, I guess well, for me, I wanted to go into primary care just to get the experience. I really wanted to just get out there and see if that's where I wanted to be. I knew I didn't want to be there, actually. I shouldn't say that, but I knew I was moving to Florida, where I am now from New York. And I wanted to just know that I could come and kind of put myself out there. If that's what I wanted to do, I could get hired as that here. I definitely don't want to do primary care. It's a lot. Like Alicia was saying, there is like a fear, like, okay, you're going to get thrust into this. You have to prescribe, you have to manage, you have to diagnose. Multitude of conditions. You're the person that they go to, and you don't want to push it off and give them referrals for everything. You want to actually use the knowledge you gained during school and apply it. But in saying that, it's not easy. It's hard. It's a lot of responsibility. It's a lot of time, and a lot of NPs and doctors can't commit that time anymore because it's just it's like I was working like 70 hours a week. And it's just insane. And so a lot of providers just choose to work what they consider part-time, but it's not, because it's really working full-time. You're just working 3 days a week versus 7 days a week. But it's so I left there, moved here. Now I'm going to be starting a remote position with a new company called Cerebral. It's strictly mental health. So I actually start Tuesday. So I'm excited because I'll be focusing on one area, not the whole body. Well, I guess that's the whole body, right? It can't affect the whole body.
Everything.
But it's hard. Yeah, I do have 2 young kids, and I obviously my career is important, but my family is important too. So I think this will give me an opportunity to kind of juggle both.
Mm-hmm.
So
the company, are you doing the mental health aspect? Are you doing chronic conditions, or are you just dealing with patients coming in and they're getting referred for mental health?
Right. So that was one of my questions, because I don't have my PMHNP. So I won't be doing the therapeutic side, the counseling, the therapy. I'll be doing the managing, the diagnosing, which is really what I was doing in primary care, because that was a big component of patients that I would see. Over the last 10 years, I would say that's really increased depression, anxiety, ADD, ADHD, bipolar. So those are that'll be the focus, managing those medications, refills, and diagnosing. But it's good because it'll be an area of one big area of focus that I can not feel that I have to, because when you're having to manage so many different things in a person, the time it takes in a visit, it's just not enough time. So they end up coming in off frequently, and sometimes we don't get to really spend time really focusing on what's most concerning for them.
You do that practice, or have most of you done this, like before you ask them, what are you here for today? Or you ask them, did I answer all your questions? Or some offices have that where they give you a piece of paper and say, what are the 2 things that you want addressed today? Yeah. And then at the end, you're supposed to say, did I address it?
Right.
Because a lot of times we get caught up on, everything else as a provider. Not that I am one, but I'm speaking as if I am one. Yeah. Just for today.
So you're teaching them.
That's right.
But if you, do they do that would you do something like that in the telehealth visit?
So when I was in primary care, yes, people sometimes they would come in and have 10 different things, and I would say, okay, so we're going to pull in 2 of the most important things, and we're going to focus on those things, and then everything else you're going to come back for at a later visit, and we'll keep doing that until we can address all those concerns you have. But a lot of times, and I know, I don't know who it was, Alicia maybe, they really aren't 10 different things. It's really the 2 things that are affecting everything else.
Yeah.
And it could be the anxiety that's affecting the respiratory, the heart, whatever. So it really doesn't work out to really be 10 different things. It's just that they feel that way.
Mm-hmm. I have a feeling you're going to be very rewarded, because the mental health concerns, whether it's anxiety, depression, or, lack of confidence, or whatever it is that underlying factor. And so many different illnesses and
Absolutely.
not able to control, like we get in our own ways. But the other part of it is you could train and take a lot of classes now.
Yeah.
To make you, to strengthen, and it's just a focus.
Yes.
Yeah, I would love that.
Yeah. I'm excited. Yeah.
That's
so
good.
to be continued.
That's awesome.
To be continued for all of us.
Yeah.
Right.
So great.
Right.
And you're going to do so well with that, Oneida. I
Thanks,
just know you are. Yep.
Totally.
And Colleen, I lost track now what you were doing and what you will be doing.
Oh, I'm in research. I'm still in research. I work for a fantastic company that I love, and I love the people, and they love that I'm a nurse. So that's another one of those little surprises. You think you're leaving. I always thought when I went into research, I was kind of leaving nursing, but I never left it. And I'm in a company that really values the fact that I'm a nurse. So it's so nice. It's so nice. I'm sorry?
Do you work for a CRC?
No, I work for a medical device company. It's called Aaron Medical. And I work on this amazing team, and it's this great company with this very cool device. And it's just, I love my job, and I love the people that I work with, and I'm always feel appreciated at work. And when you're 54 years old and you've worked for years in jobs that you weren't necessarily appreciated, you really hang on to that. So I do that. And then I work for another company called Vault Medical, and I am just a per diem nurse practitioner for them. And my role has been varied. I've done some research for them as a nurse practitioner, but it doesn't feel like a nurse practitioner because I just have so much experience with that. So it's like, it didn't feel different other than I got to sign FNP after my name. But I also, I just was working for them, being a clinical lead at a COVID clinic. And then they said they have some other projects for me, just per diem. I work when I can for them. I just try and keep some more clinical hours, just towards my license, because I really don't want to lose that. I work so hard for it. So, so that's what I'm doing, and it's going okay. It's going slow, and I don't know what I'll do in the future. Who knows? Yeah, right now I'm just happy.
Yeah, you seem it.
Yeah.
But down here they have a lot of those. What are they? Contract research.
Yep, you're well, North Carolina is the research triangle.
Oh,
yeah,
and then
Duke,
there's a lot of pharmaceuticals. So
Yeah.
there's tons of nursing positions.
Yeah,
And nurse research positions.
Yeah.
And they make a couple $100,000 easily.
Mhm.
It's nice.
Yeah, you make really good money. The work is great. You can still have that clinical component. So if you're working like on the clinical side of it, you can still see patients and have administrative. So I did that for years, and now when I got my NP, I moved to the pharma side. So medical device. Yeah.
Well, it was awesome talking with you.
Well, thank you very much. I appreciate it.
Yes.
Yeah. It was awesome.
Thank you.
And you look the same.
All right.
You do.
Yeah, exactly the
look
same.
great.
Yep.
I think I'm looking pretty tired. But thank you. Thanks for having me, and thanks for reaching out to me. Thank you for being so awesome. It's so nice to see people that you saw years ago, and then you see them grown up or whatever, professionally, not green anymore.
Yes.
Thank you for listening. 4 in Peace Podcast has a Facebook group called Nurse Business, a community created to support one another and enjoy positive ideas and thoughts. We hope you'll join us. In addition to that, for a little fun, follow us on TikTok.
Subscribe to our YouTube channel to see some clips of our live interviews and listen to past episodes. Feel free to email us with ideas for episodes, comments about our podcast, to recommend an interviewee, or if you'd like to be interviewed yourself at 4npspodcast@gmail.com. That's the number 4npspodcast@gmail.com.
Please follow us on Instagram, Facebook, and Twitter at 4npspodcast. That's the number 4nps podcast. Subscribe to us wherever you get your podcast, and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us. Thank you for joining the 4NPs podcast this week. Be sure to join us in 2 weeks for our interview with Sharon Fisher. Sharon is duly board certified as an adult NP and psychiatric mental health nurse practitioner. Sharon is the owner of Nurtured Well, a full-service mental health practice in Maryland. She is also an author and educational and motivational speaker, so you won't want to miss this episode either.
The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NPs podcast are of the hosts and guests and do not represent those of their employers.